Hello, Pharma students. I will be on official leave on Tuesday, hence I prepared my lecture in a video form. I hope you watch this on or before Tuesday lecture. I would like to start our lecture with this picture, the ant. What can we learn from the ants? At Proverbs 6:6-9, we could read, "Go to the ants, observe its ways. It prepares its food in the summer." I know all of us are happy and proud with the recent result of the BET board exam. I'm sure you would like to pass that exam soon. So as preparation, be diligent and industrious like the ant. It has no master, but it follows the rule. It prepares its food in the summer so it can have fullness in rainy season. So as for you, try to get all the knowledge for your good foundation in the upcoming BET board. I wish you passed that board too. But before that, you should pass Pharma first. So let's start getting our food. Let's continue our discussion about antibacterials or antibiotic. We start with the group of cell wall synthesis inhibitors. Cell wall synthesis inhibitors are effective against gram-positive bacteria, primarily because these bacteria have a thick cell wall. The cell wall of gram-positive bacteria are composed of peptidoglycan chain. The carbohydrates components are N-acetylglucosamine and N-acetylmuramic acid, which are attached to peptide chains. They are cross-linked together. The antibiotics that can damage this peptidoglycan chain are the following: penicillins, cephalosporins, bacitracin, vancomycin. For the mechanism of action of cell wall synthesis inhibitor, let's examine first the formation of cell wall synthesis. There are three stages of cell wall synthesis. First is the formation of the building blocks of glycan chain, composed of N-acetylglucosamine and N-acetylmuramic acid. Second is the formation of the peptidoglycan chain, the peptide that is attached to a glucan. And the third is the cross-linking of the peptidoglycan chain. This cross-linking is initiated by the enzyme transpeptidase. Take note that in the next slide, we can see that the transpeptidase enzyme binds with antibiotics such as penicillin and cephalosporin, and this prevents the formation of cross-linking between the peptidoglycan chain. The presence of autolysin further damages the formed cross-link, and the normal osmotic pressure in the environment of the bacteria causes it to shatter, causing death to the organism. Please watch the video on the next slide. Here is an example of a bacteria. Can you recognize what bacteria is this? Yes, it's a rod-shaped bacillus. What can you notice between the two pictures? Yes, normally when the cells are rapidly dividing, they produce a smaller size of cell, while if cells have been inhibited by cell wall synthesis inhibitor, they can produce larger rods of immature bacteria that we could see here on the right. And these are vulnerable to the normal osmotic pressure from their environment. Now let's go to specific cell wall synthesis inhibitors. Let's start with penicillins. As you have already known, Alexander Fleming discovered the antibiotic now called penicillin. The name was derived from the fungi Penicillium notatum, which Alexander saw a zone of inhibition on the growth of Staphylococcus around the fungi. However, clinical application was not yet realized then. It is because of the difficulty in production of large quantities of the product. It was Howard Florey and Ernest Chain in 1940 who continued the experiment on penicillin and was able to achieve purification and large-scale production of the first antibiotic. For this, the two won the Nobel Prize for Physiology and Medicine in 1945. Now let's study the structure of penicillin. Penicillin is composed of acyl side chain, which different number of carbon atoms can be attached, producing different types and efficacy of penicillin. There's also the beta-lactam ring, which is responsible to the mechanism of action of the penicillin. It binds with the penicillin binding protein, which causes the necessary action. And it also has the thiazolidine ring. For the bacterial resistance, since gram-negative bacteria doesn't have much of the peptidoglycan chain, they are inherently resistant, though they can still be affected in high concentration of the drug. Some bacteria produces beta-lactamase enzyme, an enzyme that can destroy the beta-lactam ring structure of penicillin. Decrease of affinity with the penicillin binding protein can also produce bacterial resistance. So there have been known bacteria that are producing lots of beta-lactamase that can inhibit the beta-lactam antibiotics such as penicillin and cephalosporin. Now let's go to the types and spectrum of activity of penicillin. There are three types of penicillin: the natural penicillin, penicillinase-resistant penicillin, and the broad-spectrum penicillin, which are also considered extended-spectrum penicillin. For the natural penicillin, the examples are penicillin G and B. Penicillin G is otherwise known as benzylpenicillin, while penicillin B is phenoxymethylpenicillin, which is more acid-resistant. These agents are effective against gram-positive bacteria, but can also affect gram-negative bacteria. These are water-soluble and can attain high plasma concentration in the urine. Hence, they are good for urinary tract infection. Next are the penicillinase-resistant group. This group, composed of cloxacillin, oxacillin, dicloxacillin, and methicillin, are the most commonly used penicillin from this group. They are less active against gram-positive bacteria and are generally restricted to infections caused by penicillinase-producing bacteria. Penicillinase is an type of beta-lactamase enzyme that destroys specific penicillin antibiotics. These are more resistant. But there are also some compounds such as clavulanic acid, sulbactam, and tazobactam that are added to or combined to other penicillins such as amoxicillin and other penicillins to prevent destruction of those penicillins because they act as a false substrate for penicillin. So instead of destroying the antibiotic, the penicillinase will act on the clavulanic acid and allowing the penicillin to do its action. So we have an example here, co-amoxiclav, which is the most common combination of amoxicillin and clavulanic acid. Next group are the broad-spectrum penicillins, composed of aminopenicillins such as amoxicillin, ampicillin, and vancomycin, carboxypenicillins consisting of carbenicillin, indanyl carbenicillin, picarcillin, and the uridopenicillins, piperacillin, aslocillin, and methicillin. These are effective against many gram-negative and gram-positive bacteria, including the difficult-to-treat Pseudomonas, Enterobacter, and Klebsiella. These can also be inactivated by penicillinase. Hence, they are being combined with clavulanic acid. For the pharmacokinetics of penicillin, they are usually available in aqueous solutions, and they are rapidly absorbed parenterally. Preparations for oral administration should be acid stable. Meningitis and encephalitis can enhance penetration of the drug in the cerebrospinal fluid, and they are readily excreted in the kidney by tubular secretion. Since they are water-soluble, they could readily be excreted. Hence, to enhance or to prolong the half-life of the drug, these are being combined with probenecid. Probenecid is known to be an inhibitor of organic and ion transporter. This transporter allows the excretion of penicillin and cephalosporin into the renal tubule for excretion into the urine. Now, in the presence of probenecid, this is inhibited, prolonging the lifespan of penicillin and cephalosporin in the blood. On the other hand, probenecid can also inhibit the urate transporter. This is responsible for reabsorption of uric acid. Now, probenecid prevents this reabsorption of uric acid and enhances the secretion of uric acid into the urine. Now, for the adverse reactions, penicillins are known to produce allergic reactions, even in humans. So, one example could be dermatitis, redness in some areas of the skin. They can also cause CNS toxicity. This can be due to disruption of acetylcholine function, causing flaccid paralysis. and superinfection, promotion of more resistant bacteria. For the drug interactions, penicillin should not be combined with bacteriostatic antibiotic. Why? Because bacteriostatic antibiotic will prevent the formation of cell wall, the target structure of penicillin. Aspirin and phenylbutazone and sulfonamide can displace penicillin from the plasma binding site, reducing the amount of penicillin that could act in the target area. And the presence of food can decrease absorption of penicillin. So normally in this case, antibiotic can be given 30 minutes after meal or before meal. Now for the dose rates, try to be familiar with the dose rates of common penicillins that are being used for small or large animal. Like penicillin G, it is commonly given as 10,000 to 20,000 IU per kilogram. IM or IV every 6 hours. For amoxicillin, 20 to 30 mg per kilogram per os every 8 to 12 hours. Benzathine penicillin is the long-acting penicillin that can be given every 72 hours. And for carbenicillin, 50 mg per kilogram IV every 6 hours. I don't expect you to memorize everything, but at least you have an idea how to compute for the dose of the antibiotic. So this is an example of clinical indication of penicillin. Who can guess what kind of infection is the piglet suffering from? It's caused by Staphylococcus, and the condition is called greasy pig disease. The common treatment for this is an injection of penicillin. Take note that this preparation, penicillin is combined with streptomycin, a protein synthesis inhibitor. They have a synergistic effect such that this one is good for gram-negative and this one is good for gram-positive. Another indication of penicillin is tetanus, manifested by spastic paralysis in pigs and dilated nostrils in horses. Usually, double dose of penicillin are being used to treat this condition. Now let's go to another cell wall synthesis inhibitor, quite similar to penicillin, the cephalosporins. Cephalosporins are normally the second drug of choice for penicillin. The source is Cephalosporium acremonium, and they also have a similar chemical structure to that of the penicillin. Cephalosporins are classified into the generations that they are discovered. The first generation cephalosporins are cephalexin, cephadroxil, cephalotin. They are being used for penicillinase-producing staphylococcus and good for bone and tissue infection. For the second generation cephalosporin, we have cefaclor, cefuroxime, cefamandol. Second generation cephalosporin have an increased gram-negative spectrum of activity. Pseudomonas and Enterobacter are usually resistant. We also have the third generation and fourth generation cephalosporins. They have wide activity against gram-negative bacteria and are resistant with beta-lactamase. For the adverse reactions, similar to penicillin, they also can cause hypersensitivity reaction, nephrotoxicity, local irritation and pain from intramuscular injection, and thrombophlebitis for intravenous injection. For the dose rates, try to be familiar for the dog and cat. Now, for the last two examples of cell wall synthesis inhibitors, we have bacitracin and vancomycin. Bacitracin is discovered from bacteria Bacillus subtilis. The mechanism of action is based on the inhibition of the second phase of cell wall synthesis, wherein the formation of the peptidoglycan chain is being disrupted once bacitracin binds with the bactoprenol responsible for allowing the entry of these building blocks. Spectrum of activity, they are good for gram-positive cocci, bacilli, staphylococcus, and streptococcus. For the clinical use, they are being used for gut sterilization and superficial infection because primarily these agents are poorly absorbed orally and also in the skin and mucous membrane. So, therefore, they can be used since they could stay for a longer period of time in the gut. They are used for gut sterilization. And most preparations are for topical administration. They can also be absorbed readily through IM, but they are not given systematically because it is nephrotoxic. So most preparations are available as sprayed premixes or topical applications. Next, we have the vancomycin. For the source of vancomycin, it was derived from Streptomyces orientalis. For the mechanism of action, similar to bacitracin, they inhibit the second phase of cell wall synthesis. For the spectrum of activity, they are good for cocci and bacilli. Now, let's go for the second classification of antibiotics, the cell membrane labilizers. Example of these are the polymyxins, which are derived from Bacillus polymyxia and Bacillus colestinus for polymyxin B and colistin, respectively. Now, for the mechanism of action of polymyxin, they are known to bind to the phospholipids of cell membrane. They are like detergents. They can have both lipophilic and hydrophobic ends. The initial damage is to the cell wall and then to the periplasmic enzymes. The liposaccharide component of the outer membrane of gram-negative organism interacts with the amino group of the cyclic polymyxin peptide. The fatty acid chain tail portion of the drug penetrates the hydrophobic areas of the outer wall and produces holes in the membrane. causing intercellular constituent to leak out from the bacteria. Now, this does not require rapid multiplication of the bacteria. For the spectrum of activity, these are effective against gram-negative bacteria, such as Enterobacter, E. coli, Shigella, Pastorella, Bordetella, and Salmonella. They are also used topically as a single agent to treat Pseudomonas infections of the mucous membrane, eyes, and ears. This is an example of ophthalmic preparation of polymyxin B. Now for the pharmacokinetics, these drugs are poorly absorbed from the gut, mucous membrane, and the skin. And once absorbed, they can be distributed within the extracellular fluid, but not on the cerebrospinal fluid. They could also be excreted in the urine unchanged. For the drug interactions, this binds with quaternary ammonium compounds. These are examples of antiseptics. They could bind with tetracycline, chloramphenicol, sulfa, and carbenicillin. Their actions are inhibited by calcium and magnesium and Phos concentration. Now, polymyxins have similar adverse effects to that of penicillin. They can cause nephrotoxicity via the destruction of the cilia of the tubular cell in the kidney. Neurotoxicity can be disruption of acetylcholine function, causing paralysis and allergic reactions. Now that ends our coverage on two classes of antibiotics. We have the cell wall synthesis inhibitors and the cell membrane labilizers. Now, can you remember the following? The mechanism of actions of penicillin, cephalosporins, bacitracin, vancomycin, polymyxins, and colistins. Can you enumerate the spectrum of activity of the above antibiotics? What are the clinical or disease indications of the above antibiotics? What drugs should not be combined and why? Can you recall the use of probenicid? How about the function of clavulanic acid? If you can remember to answer these questions without looking back in the lecture, that means you're good to go. Prepare for the next lesson, next meeting. Our next coverage is the protein synthesis inhibitors. See you next meeting. Bye.